everyone.
Assalamu alaikum and welcome to Ainy&Hajra Unscripted.
Today we have a very interesting episode for you, and it's about mental health.
Mental health struggle is everywhere. They're often hidden, trapped behind stigma, silence, and shame. Millions of people are battling depression, trauma, anxiety, and loss. And very few people get the help they need. Today, we're opening up a very important conversation. It's why mental health matters and bring hope to all those people who are watching and suffering far, far too long.
Today we are extremely excited to welcome Sanaa, who's actually a dear friend of mine. She's a brilliant psychotherapist working in the mental health space in Pakistan and the UK, raising awareness about mental health issues. She also works with the British Asian Trust, which is a charity working to remove stigmas around mental health, raise awareness, and provide avenues for people who are seeking mental health support in places like Pakistan, India, Bangladesh, with a lot of South Asian communities. What people don't realize is that mental health issues don't just end with the mind. They can manifest into your entire body and affect the communities and societies around you. So I'm so excited and happy that we are addressing this topic today.
Sanaa, thank you so much for giving us your time, especially on your third trimester. Any day, huh? Any day.
Yes.
Congratulations.
Thank you so much.
Can we begin with talking about how mental health is, as a snapshot, is viewed and treated today?
Yeah, sure. And thank you for having me. I think it's so important to talk about issues such as mental health, which often aren't talked about, very stigmatized. So having platforms like this that are targeted for youth, women, etc., is so important. So mental health, I think globally, it's a very kind of taboo subject. It's stigmatized. We don't talk about it enough. It's not integrated into our natural education system, healthcare system, nearly as much as it should be. And this is a global phenomena. And I think obviously in some countries, I work in Pakistan and South Asian countries, there's often a lot more stigma associated with it. But I also feel that after COVID, a lot more conversations are happening around mental health, because I think COVID was a time where everybody suffered from some form of mental health issues. There was a lot of kind of collective suffering. There was isolation, there weren't social support systems. People realized the working system changed, the education system changed, working mothers from home had to struggle, with kids homeschooling, etc. So I think that really sparked conversations, and I found that working in the sector, a lot more is being spoken about. The approach has changed. We've realized the importance of not just treatment, but prevention and early intervention. We've realized how much youth can suffer and children suffer in different ways. It brought light to kind of domestic violence, workload stress. So I think it's a positive time for mental health. A lot more conversations are happening, which is great, but a lot more needs to be done. A lot more needs to be done.
What are some of the barriers that people face when it comes to seeking support in mental health in this space?
So I think it's different. I think there's a lot of lack of awareness. So there is the stigma, but there's lack of awareness of when to seek support, how to recognize symptoms, and also where to access support. With physical health, it's often, obviously if you have a flu or you have a more severe physical health issues, people have more knowledge about when they can do stuff at home, when they can build their immunity, when they should see a doctor, when they should see a GP versus a specialist. There's a lot more knowledge. I think in mental health, people don't recognize the difference between maybe mental health, mild, moderate mental health issues that are triggered by something that's happened in your life, or more kind of mental illness or severe psychiatric issues. So I think that understanding for not only the individual who's suffering, but also the people around, the family members, even employers in a workplace, to recognize those kind of symptoms, teachers, when there's early diagnosis, it's really important to seek that professional help at the right time, and to look out for certain symptoms. And I can kind of highlight maybe a few also that, it's very normal sometimes to feel anxiety is one. Anxiety is a symptom. We all feel a bit anxious when we're giving an exam or public speaking or something or the other. But then there's kind of anxiety disorders. And it's really important to understand when something affects your appetite, your sleep. You don't have pleasure in the normal activities that you would take pleasure in. You have cognitive difficulties, so your memory loss, brain fog. It's kind of just not being able to function on a daily life. Your relationships suffer. That's when it's time to kind of seek professional support, and there is professional support available. And mental health issues can be up and down. So it's all about kind of realizing what coping strategies you should adopt to learn how to deal with those.
Would it be fair to say that, just adding to that, that some of the barriers would be that because it's a hidden sort of,
Yeah.
I wouldn't say it's a disability, but it's a hidden symptom, or these are hidden ailments, whereas when it's physical, obviously, your heart is hurting, or something's paining, or there might be a physical manifestation. Because it's a little bit invisible, people get sometimes confused. That might be a barrier. And shame, do you think shame is a barrier? And stigma associated with, if I have to go see a therapist, or I have something wrong, like there's a lot of shame. If I get khuda na khasta cancer, or there's something growing, there's no shame usually, but somehow I feel like people are more afraid to talk about that. And why do you think that
Definitely, I think the stigma is a huge part of it. And it comes from the perception of mental illness. I think people think that it's not treatable, and that often happens because it's reached a stage where it's very severe. So that's why I can't emphasize on early intervention enough. It's so important to get that early intervention, because when it becomes so severe, it's also people aren't comfortable and aware of how to deal with it. So when people have things like delusions or hallucinations or paranoia, or they act in a certain way, and you're right, it's hidden. It's not something that people can empathize with, because you don't have the scars or the kind of physical symptoms to look at and to empathize with. So I think it's very much around stigmatized, lack of understanding, lack of being able to see and understand, and also the language. People don't know how to communicate when they're going through something. It's how do you explain to someone what's happening in your head, what's happening inside internally. And stigma, I think the shame in specific cultures, and I can speak from South Asia especially, but I think there's shame everywhere, is that the language ye pagal ho gaya, which is literally mad. And you'll be surprised, till very recently, even in places like Western society such as the UK, etc., it was the way it was treated. Also, it was kind of locked up, isolated, they're dangerous, labeled. And it's taken a while for that to kind of thing. So people kind of perceive people with mental health illnesses as being dangerous, not productive members of society, write-offs, which is why a lot of psychiatric institutes were treated as abandoned kind of grounds. So people would just leave their family members there and never come back. And I think one of the main treatments for people with mental health issues is to have them reintegrated back into society.
So, Sanaa, how do we build a trust with a new client, especially someone who wants to come to you and seek help? How do you build a trust?
So I think it's a two-way communication. I think I always say, and I even tell my clients, this might not, it's very important for this to work for you. Because there's a number of things that come into play. It could be someone doesn't feel comfortable talking to a female therapist because they have things to discuss if it's a male, or someone, or they've had some trauma in their life around someone that kind of matches how I am. In Pakistan, I get this a lot, where kind of older people don't feel comfortable talking to a young person. But in therapy, it's so important for that match to happen. And what I can do as a therapist, so there's some things that are out of my control, but what I can do as a therapist is non-judgment. And I think that's really, really important. And it's part of something throughout mental health. I mean, I know in healthcare, it's, non-judgment, but especially in mental health. your own transference, so your own beliefs, your own kind of strong opinions should not come out in the therapy session. That person is your client, so even if they've done something, I mean, I worked in domestic violence in London for a while. um, Even if the my client was kind of projecting their abuse onto their children, for example, in as a therapist, it's not my job to judge them. I need to show compassion, I need to be attentive, I need to listen to them, make them feel comfortable. And then obviously there are other systems in place that can kind of work with them if it's a legal issue, if it's something else, a social worker, etc. But my job is to trust them, build that compassion, and not judge. And I think that's very important.
It's like the whole thing about shame. It doesn't matter which tabka you're from or which, yeah, I guess, how educated or literate or aware we think we are. But I mean, I will just say from my own experience, I went through and I've talked about this, right, Hajra, and other episodes about sort of the postpartum, I don't know what to call it. Is it postpartum?
Postpartum depression.
I don't even know if it was like it was a couple of days of so much stress, and I started hallucinating, and I was having a very tough time because my kid was in ICU and all of that. So I remember just not being myself
Yeah.
for a while, and having family members. I heard them like, and I like being like, kya pagal ho gayi hai Annie, isko kya ho gaya? And they're all and the people that said that, and it was actually one of my khalas. She's a mother to two. We've seen, but just because I think in that generation, and this was Pakistan, but it could be anywhere in the world, they just got on with it. Like in a way, because then I had a deeper conversation with my mom, and I was like, "Main pagal ho gayi?" And she was like, "Beta, it's not that. It's just that when we, in our generation, right, our parents' generation, women were left, right, like losing it is not the right term, but whatever they were going through, there was no education, there was no discussion about it. They were just sort of shunned into the room and be like, she's just thodi si, like it's a difficult time." And that, like, the fact that she said that to me, and I was like, so that's still there.
No, that's so important. I'm glad you brought that up because postpartum depression, and I know you say, again, there's a spectrum, there's different levels of severity. So we call them maternal mental health issues, but they're prevalent I know in Pakistan, 1 in 3 women suffer from maternal mental health issues. So literally, like, we're sitting in a room, one of us, but I would say 2, because even when I had my first child, it's so difficult afterwards. There's hormonal imbalances, especially with women today. And you brought up generational. There's so much kind of generational trauma that's passed down, but also to realize that the world is different. Women today, we're working, we're more independent, we have other stresses in life, and then we have a child, so our identity is kind of snatched from us as well. And then you have this child to look after, and it's so common. And I think if more people, so I'm so glad, because having your kind of platforms and your celebrity influence as well, if more people speak up about it, the shame, I think, will reduce, and the stigma. Because someone watching could be like, iske saath ho sakta hai, it can happen with me as well. And I think the importance of speaking up and just having these conversations and the effect it can have on other people who are suffering is huge. So with maternal mental health, I feel like support groups. I know when I went through it, just having other pregnant women and other mother friends who I could talk to was my, the best support. And having a social support system in place. But someone who doesn't have that, so someone who hears negative remarks, like you did, for example, or someone who doesn't have a support system or doesn't have a supportive partner with them, or doesn't have the right coping mechanisms in place, that can get really severe. And maternal mental health and postpartum can get so severe, people don't feel connection with the child, people try to harm their own child. And I think the stigma is there because it's like, what's wrong with her? She should be happy. It's such a happy time in her life. But they don't understand that it's also a very difficult time. And it's okay to admit that and accept that. Get the help you need. Take time out for yourself. And I think once people start talking about it, once people start recognizing it, there will be more integration that, support should be available at the primary care level when you have the baby, post baby available, so policies on a national level can start to take place. So I think that's really, really important to acknowledge what you're going through, share it with others, and get the right support available.
I agree. When I went and I had my baby, and it wasn't extreme, but I went through postnatal depression just
Yeah.
because I became someone I didn't resonate with. I was a
Exactly.
completely different person. But what I think kept me sane eventually
Yeah.
and didn't spiral out of control is a support system, right? And then you keep reminding yourself
Yeah.
that you eventually you need to also enjoy
Yeah.
having the baby, but at the same time give yourself time to
Exactly.
heal. If you've spent 42 weeks being
Yeah.
pregnant and so many hours giving birth,
Yeah.
it's just gonna, yeah, exactly, in my case 42 hours giving birth.
42 weeks.
So 42 pregnant, 42 so it would just take time. But that's great. There are all sorts of women, and as long as people are out there to support them, family, friends, and so on, they can control it. One thing is on my mind because I've got a son who's 10.
Yeah.
Social media.
Yeah.
So social media, do you think it influences mental health positively or negatively?
So that's again a great question, and I think that's a debate that's going on in many sectors, but especially mental health with youth. I mean, it can be both. It can be both. Negatively, obviously, I think is more because we look at the effects of social media. Social media wasn't really a part of, I know, my childhood when I was very young. It came about much later. But even then, I can start to feel the pressure, the cyberbullying, the comments, the likes, and how kind of into it we all are, right? And young people, like I know there's been a lot of recent kind of shows, documentaries, etc., highlighting these issues. The recent one was adolescence, which I think really struck, hit home, especially with boy moms.
100%. Yeah.
It's something that I was just watching just last week also, and it's just that access to an ongoing, constant reminder of how popular you are, how your physical looks are, comments from other people, social consciousness, comparing yourself, body image issues. So all the issues that were always there become a constant reminder to you, and you have access to them, and you have other people's comments, right? Back in the day, it was maybe bullying just in certain instances or at a school or at a playground, etc. Now it's constantly online. And the amount of girls that you see with body image issues, and not just girls, actually, boys as well, the amount of kind of, I have even older clients coming to me and sometimes talking about, on social media this happened and I didn't get enough likes, and my ex, so relationship issues, my ex commented on this thing, my husband commented on this. So I just feel it can be a very negative environment. Positively, of course, the things are things like this. You can start to raise a lot of awareness, I think, on social issues, on many issues, like I know, you spoke about education before, and I was speaking about mental health. You guys have touched on a lot of topics, where to seek help. Where recently we're doing kind of a media campaign in Pakistan, which is a mass media with one of the largest media platforms, Geo, on mental health. And it's the first time a media company has kind of partnered with the British Asian Trust, which is an NGO, to talk about such stuff. And we're evaluating, and we saw that social media is where we're getting the most reach.
Okay.
So people are actually kind of looking at TikTok, YouTube channels, etc., to learn more about mental health as well. So, Hajra, it's quite a loaded question because there's so many topics, but I do feel censorship.
Okay.
Parents need to be fully aware, like parenting, and that's a whole different topic when it comes to mental health. Needs to be fully aware of what their child is accessing. There needs to be age limits. I mean, I don't think the social awareness and the emotional awareness a 12-year-old or a 13-year-old child has when it comes to their own identity, their own confidence, their self-esteem is there at the time. So, age is really age appropriate content, etc. And just trying to utilize it for more good than bad.
Is there any difference between raising a boy and a girl?
Lots. I think, it's parents have it hard, I think, just generally in today's world. I think when we talk about mental health, there's a lot more, there's many different things. I mean, in our society, we talked about stigma, for example, because a lot of kind of development work and education and mental health programs, and I work in the sector focused on women and girls a lot. But in mental health, it needs to be all, because men were taught at a very, in certain cultures, but I think everywhere it's like, toughen up, don't cry, you're weak, you're a boy, you need to be strong, you need to be brave. And I think that perception that boys have in them when they grow up and they do start to suffer from maybe depression or anxiety or feel low, they feel weak. They feel that they're not masculine enough, and that even worsens. And statistics show that men don't seek support as much as women. Okay, women might have a higher rate of mental health issues, but men have a higher rate of successful suicide. And that's often because they don't seek the right support. Also, women have friend circles,
A community culture.
they're
which,
able
yeah.
to express themselves. I mean, we're considered very emotional
Offload.
sometimes.
Yeah.
Men keep things inside, and when that's another example, because I think, Annie, you asked me when should people seek help. It's when things start to build up inside of you, and you don't get the right support, then often it leads to a more severe thing, which often, as I said, men do have a higher rate of suicide.
I was just going to add to what you said, because you asked, we're boy moms. And I also feel like when I'm talking, just like you said, because men feel shame, and they feel, even more scared to talk about what's going on in their head. They just don't feel like, they don't feel safe, or they've, as you said, been told that toughen up, or why are you being so girly? Why are you talking about your feelings? And we know that men die earlier. I mean, there's a lot of stress because a lot of men are the sole bread earners in South Asian communities all over the world. We still have that sort of family set up in many parts of the world. But men, I feel like even with friends, when we're talking about couples counseling, sometimes I hear a lot when I'm talking to my friends that the husband or the partner, male partner, doesn't want to do it, or they're just like, I don't want to do it. It's not something for me. Why do you think? I guess that's it, right? Just this thing.
It is weakness.
There's a
And
big
you'll
gender
see,
issue.
so there's been a lot of talk about employee well-being and corporate sector now learning about mental health, because actually mental health is an individual issue, yes, but it's not. It affects the family, it affects the communities. Caregivers have one of the highest rates of mental health issues as well. And it affects the economy, because and there was a study recently that every dollar invested in mental health from the corporate side, you get $3 back. Because productivity reduces,
Increases.
Increases when you invest in it. But when you're suffering from mental health issues, but you'll hear of people taking kind of, I'm not feeling well, I'm going through something at home, like I'm going through, you mentioned kind of if someone has, God forbid, cancer, but even if they have kind of a sick or they had COVID, etc., it's like, take your time, rest. Have you ever heard of someone calling in and being like, I'm feeling very low, right? That's not normalized. People don't. Some companies now are really starting to look into it, but why not?
Well, people joke about it. They say, I'm taking a mental health day because they feel like they're doing something extra. But it's not extra.
It's not extra. And the thing is, you need to take that time off. But the other side, what you just asked, is if you're working in an office environment, especially if you're a man, but even women, or you're at a kind of higher position and you are seen going to a therapist, or you've taken a mental health day, people are scared. What are other people going to perceive? I'm not a good worker. I'm not as good as my other employees. It might reduce my chances as a promotion. It might kind of make me look weak to my other kind of people below me, my junior staff. So it's again that stigma in every kind of way, every kind of different level. I mean, you said socioeconomic background has no, mental health issues are everywhere. They manifest in different ways. In fact, working in a country such as Pakistan, where there's such a diverse community, you will see, yes, low-income communities sometimes have a lot more issues related to financial stress, etc. So there are different triggers because they're more stricter kind of cultural and traditional religious things. The way that it's perceived, the way it's treated is different. But in urban and upper class also, there's a lot of issues. I mean, we hear about the youth, and it's kind of domestic violence is throughout, abuse is throughout, this issue which I said with men, this issue which I said with youth, social media. So it's not something that, is targeted at one group of people. It's just the way it's perceived and the way it's treated and the way it's handled. And in fact, some people I often find in kind of the so-called kind of upper class are more ashamed because they have a type of social class.
So Sanaa, In your personal experience, how do you feel friends and family
Mm.
should help an individual in their mental health journey?
Yeah. So I think that in itself is the most important place to raise awareness, because we spoke about our mothers and our khalas and the generations. Mental health wasn't recognized at that time, right? It was even more taboo, even more stigmatized. People weren't aware, so they just dealt with it. That's not necessarily a good thing, because even my mother will say stuff like "kuch nahi hota," like deal with it. It's in your head. I went through this, but it manifests and it has their effects, their own insecurities, their own things. It can manifest in an internal way. They might have their own anxieties. It might have affected their relationships. So that's not a good thing that you just carry on. um so coming back, Hajra, what was your question?
For how can friends and family
Yes.
help an
So
individual?
friends and family, I think, it's important for them to be able to recognize they're not professionals, but they can play a very important role in making that person feel more supported, preventing it from becoming more extreme, and also encouraging them to get support. So they need to look out for the signs and symptoms. They need to be able to recognize that this person is suffering. They shouldn't be add to it. So when you talk about bullying, when you talk about labeling, laughing it off, oh, you have everything, what are you doing? You're just weak, things like that. So I think it's very important. I mean, we all play an important role, whether you're a mother, whether you're a father, whether you're a sister, a brother, a friend, a colleague. You should be able to have the sensitivity and the compassion to look at the signs and symptoms and then say the right things.
And what are the right things?
So the right things would be like, you know, check in with people, ask how they're feeling, and don't kind of lessen their experience. So a lot of people often say, oh, I also, this happened to me as well and stuff, because everybody has different coping strategies. And if someone's severely depressed, you can't say things like, oh, just come out, lying in bed is not going to help you, get out. These are all things that people might say with good intention, but to someone who's severely suffering, it's not good, because they can't snap out of it, they can't just go out, right? So I think just being there, listening, attentive listening, having that compassion, letting them talk, and then encouraging them and educating yourself with kind of the right, encourage someone, speak to this person, there's a counseling service available, encourage them to get that support is most important. So I think often we tend to give advice and dictate what happens. We mean well, and that's why it's a very difficult. So I think it's a difficult area, because you sometimes have good intentions and you want to say it, but it's really educating yourself on what the person is going through and being emotionally aware as to how they're taking the response, because that person might just isolate themselves more. They might isolate themselves more.
Would it be fair to just, I guess we're going to wrap up soon, but you know how we were talking about physical illnesses and mental illnesses and invisible thing, but like we know that stress is the number one cause of death.
Yeah.
And almost every disease starts with stress. So it's, is that fair to say that like certain cancers, certain tumors, certain growths start with stress is that like one of the biggest causes, and stress is mental. So we don't seem to like, maybe we don't understand how the gravity of stress itself is a mental health issue, and that can manifest itself into then a physical issue. So a lot of those physical issues that we know about and we're ready to deal with, but we're not dealing with the root cause, which is mental health issues, because that will start stress aapse shuru hoga. Stress will lead to a physical, so it's a whole cycle, and then your community, your family, and it can be like the plague. So I think we can't stress enough how important it is to talk about mental health, to talk about these issues, to make it a safe space and to seek help. And Sanaa, just lastly, what are some of the, in Pakistan and everywhere in the world, how does one access help if they want it?
So just your first point there is really important, because I think we need to stop looking at mental health as a separate vertical.
Yeah.
It's integrated. There is no health. I mean, one of the highest rates of mental health issues are related to physical health issues. If someone has a long-term physical health issue, I mean, that's why with cancer patients, they have seen that the health outcomes are improved if they add that level of mental health treatment and counseling. They've seen it in TB patients in Pakistan. COVID, they saw it.
We're talking about treatment ke
We're
saath.
saying that if you integrate mental health treatment into their
Got it.
treatment, their medication, etc., the health outcomes are more positive.
Okay.
And same way you said, stress and mental health issues can manifest in physical health issues, heart attacks, cholesterol, all kinds of physical diabetes. They're all known to start off with stress.
Well, it's the whole placebo thing as
Yeah.
well. It's the whole placebo effect thing. If you believe you're going to get better, even if sometimes it's your belief, your positivity that can get you through so many things in life, and that has all to do with like some good, being at a good level of mental
And
health.
self-care, right? So
Yeah.
like if you're feeling a bit fluey, a bit feverish, sometimes just getting up, dressing up, kind of making yourself feel a bit better, meeting a friend makes you feel better, and you do actually tend to feel better. And mental health, not just with health, I think it needs to be, it's everywhere. Mental health is whether you have natural disasters, earthquakes, floods, we're seeing so much of that in the world today. It's the mental health also. Education system, I know you guys have had a session on education. Pakistan has 1 in 5 school-going children suffer from social and behavioral and emotional issues. And that's just school-going children. We have one of the highest rates of street children and out-of-school children. And that is, again, a completely different amount of trauma that these kids, street children, the amount of sexual abuse, physical abuse that they go through. So when you do any plans or policies or interventions for any group of people, whether it's through education, whether it's through disaster relief, etc., and you don't look at mental health, you're not going anywhere. I mean, this show that we talked about, and you asked about boy adolescence, he was going to school, right? If an education system isn't holistic and it doesn't look at mental health, it's not going to cause benefits. It can actually cause harm. So again, when you asked about the landscape of mental health, I think mental health needs to be something that's integrated into, stop looking at it as something different. Education policies, healthcare policies, parenting, it should be something that we're taught, look out for mental health, because that child is never going to have the confidence, the self-esteem, and be productive in life. They're going to go into the wrong things, such as bullying, addiction, domestic violence and abuse, etc., if their mental health is not looked after from an early age.
Sanaa, lastly, I would like you to share your few pointers, effective exercises or techniques that people can, sitting at home in their fast-paced life, stressed, overwhelmed, anxiety. What can they do? Just a few pointers. What can they do sitting at home? And also wrapping it up with where can they get help if they want to reach out to you?
So I think it's important for mental health to have self-care in place. So it's so important to take our me time, have coping strategies, what we call positive, because there's negative and positive coping strategies. Exercise. I can't emphasize the effect of exercise. I mean, it's actually been scientifically proven. Serotonin release, it increases happiness, etc. So exercising, I know yoga, mindfulness works for some people, but remember, one size doesn't fit all. So whether it's reaching out to a friend, a colleague, someone that you trust, or even someone that you don't know, speaking up, expressing yourself, and then getting professional help. Professional help, I mean, I've been for professional help. Others have shared their stories. It's not something to be ashamed of. It's actually something to be proud of, because you're brave enough to speak up and go out and seek that support. There are many different, the good news is for mental health support, there are many different platforms now available. You can access online, you can access through the phone, you can access in person. It's really about what suits you. You have counselors, you have psychologists, you have psychotherapists, you have psychiatrists. So everybody, please educate yourself, because it's so important to go to the right person and seek the right kind of support that works for you. And very quickly, I mean, because I often get asked the question, what's the difference between a psychiatrist, a psychologist, and a counselor? Psychiatrists are medical doctors that are able to prescribe medication, and they can diagnose. Psychologists are clinical psychologists who should have kind of a master's degree, at least in a bachelor's and a master's degree. They are able also to help with diagnosis, but it's a lot around talking therapies, screening and assessment and all of that. And counselors should at least have diplomas or some sort of an educational background and experience, but they are more around kind of mild to moderate issues which you need to go through sessions of talking therapies.
Thank you
Great.
so
Thank
much.
you
Yeah.
so much for your time. Thank you.
Thank you for having me. Thanks.
I hope that this episode was informative, interesting, and a lot of our viewers are not just women. There's a lot of guys who I interact with, talk to on a daily basis via my podcast. There's a lot of stigma around accessing mental health, and especially for guys, but we need to change that narrative. We need to make people not feel ashamed. I really hope you enjoyed the episode.
Absolutely. And please take the pointers that Sana gave us about slowing down, giving yourself time, reaching out to your friends and your family, and being there for each other, because life is on a crazy roller coaster right now, and do not know what someone's going through. Thank you so much for being with us in this episode. We will see you next week with another topic. Till then, take care.
This is Ainy&Hajra Unscripted.